Medicare has gotten serious about preventing hospital readmissions, the number of times within a month that a patient winds up back at the hospital after treatment. In fact, the government is now penalizing hospitals with a poor track record of readmissions. All of this is driving a new emphasis on home health care, in particular the follow-up care required after a patient leaves the hospital. Well, the Allegheny Health Network responded to the new rules by creating a health care at home program, which seeks to improve communication and the quality of care patients receive once they leave the hospital. And already the benefits are flowing to the bottom line. Dr. Brian Holzer is Senior Vice President of Home and Community Services for Highmark Health's Allegheny Health Network. Welcome, good to have you here.
Great to be here, thanks for having me.
Yeah, so this is really turning your world upside down, I guess, in terms of what happens to patients after they leave the hospital, right?
It is, and it's all good.
Yeah?
And the goal here is to continue the care the patients receive in the hospital and ensure that once they leave, we haven't dropped the ball. We continue to allow them to recover in the comforts of their home and get to a point of being independent to continue with their life.
Yeah, I've been on both sides of this equation with family members who've just been sort of cast out by the hospital, probably sooner than they would have preferred, and also this newer model where there is this follow-up care. So in your system, how does this work exactly? How do you really provide that kind of service?
This is a new-to-the-world solution that's relatively unique on a national level, and it's something that we built from the ground up, and it's less than a year old. And so it is an end-to-end solution. So what we did was rebuilt the front end where we created a transitional care coordinating platform where we actually have a single individual that will interface with the patient, their families, and even the clinical team to work with that team to develop the care plan, understand what the patient actually needs, and help with the process of assessing and transitioning them back into the home. We then brought all of the companies that really don't work together typically underneath one umbrella. Skilled nursing care, home infusion, home medical equipment as some examples. They're all under the same umbrella. We coordinate all the services across those companies and provide a seamless service for the patient once they're in the home.
So before, a lot of this was kind of left to the patient. If you were smart enough, well-educated enough to be able to do your own follow-up, you would kind of reach out and maybe you could pull together these kinds of services. But it's pretty complicated for a family to do that after they've had some sort of major medical treatment.
It's complicated enough in a time of health, but boy, I mean, unfortunately what happens is patients are faced with this and don't think about it until it's too late and they're in the hospital in the situation. And now they got a loved one that's 3 days after open heart surgery and they're sitting with a nurse saying, "You're going home." And now they got to figure out, what the heck do I need? How do I get better? And you're making dozens of phone calls and you're at the mercy of other individuals coordinating that care. We enter the equation, we sit with the family, we understand their needs, and we ultimately talk with them with what they're trying to get accomplished. We talk with the clinicians, we make all of the arrangements, and we coordinate the care in the home so they can worry about one thing, and that's getting better.
And clearly, the federal government wanted to do this in the Medicare program. I assume it's because it's got to be a cost-driven, in part, dynamic here. Does it seem to make a difference in terms of the cost of providing all this service and getting the patient well?
It does, and Medicare has been on the sort of the forefront of saying that a lot of the variation that occurs in cost is occurring in this space. The 30 days after a patient leaves the hospital, there's great variability in the types of care patients receive. There's very little standardization, and it's driving a lot of unnecessary costs. And so our program is really set up not just so much for the care of today, but where we're going tomorrow, where hospitals are going to be reimbursed not just for the care of the hospitalization, but what happens to that patient for the 30, 60, and 90 days after. They're going to need people like us, healthcare at home, that have coordinated this and taken out a lot of the complexity to achieve their goals and the goals for the patient.
Yeah, I would think for the hospital business, though, this is challenging because this is about reducing the number of nights that people stay in the hospital.
It is, but I think across the country people are realizing that we really are at a metamorphosis stage where we're going to go from a fee-for-service volume-based environment to a value-based environment where it truly is about the episode, not just widgets or actually, you know, the cost of care of individual services. And so it's really going to take a total change in mindset where we think more globally about what the patient will need, how much of that care can actually be reasonably delivered in the home, which is a lower cost setting, and it's a setting that I think most patients want to be in. So we're at the forefront of this, making sure we're getting rid of a lot of the complexities to prepare for the future where we think it's going to be.
Can you talk a little bit about the financial bottom line, but how about the health bottom line? Is there evidence already that this approach really makes a difference for the patients?
The bottom line to health is substantial. We have just in 1 year, and this is a one-year-old program, reduced the readmission in a population of patients we treat by a full 5%. That actually translates to we have avoided nearly 400 unnecessary readmissions to the hospital, And that quantifies to about $4 to $5 million in savings. And when I say savings, it's not necessarily savings to a hospital, right? It's savings of unnecessary care, and that's savings to the system.
And that's, yeah, more time that people have to be subjected to treatment.
right.
It's no picnic necessarily being in the hospital. If you can avoid that, you're getting back to your normal life and that much sooner.
That's the goal. It's to stop thinking about sort of the short term and think about sort of over time what's in the best interest of getting that patient back to a high quality of life, and in an area, quite frankly, where we may prevent admissions to the hospital down the line in a future state. It's to get them healthy, make sure that they're in the comforts of their home, receiving the types of care that they need so they can get back to living an independent life.
No, really cool. Great to see this sort of leadership and creativity happening here in our region. Dr. Brian Holzer from the Allegheny Health Network.
Thanks for having me.
I appreciate it. Yeah.
Thank you.
And when we come back, we'll catch up with Candy Castleberry Singleton, a woman who traded a big-time job in the healthcare industry for a startup, a new national nonprofit focused on dignity and respect. Stay with us.